All right, thanks, Ryan. Well, March is National Colorectal Cancer Awareness Month and serves as a reminder to get checked for this disease beginning at age 45.
While formal screening at the age of 45 is recommended, there's always room to better understand your own genetic makeup and risk factors, as this disease is proving to hit some at an even younger age.
From screening to diagnosis and treatment, advocacy and support, we bring in now Dr. Paul Health and stage 3 colon cancer survivor Andrea Bauer. Thank you so much for being here, both of you. We appreciate your time today.
Thank you. Thanks for having us.
I think so many people just don't know where to start sometimes to have the conversation. So this is good. I'm happy that you guys are here to have a kitchen table conversation. You know, Dr. Health, we'll start with you. With an understanding of where colon cancer ranks among cancer patients in the United States, how common is it?
Well, the lifetime risk of colorectal cancer in the United States is about 1 in 25, so it's quite common. There are roughly 150,000 cases across the United States every year, and there's been a striking rise in younger patients under the age of 50 over the last 30 years, so a 50% rise in younger patients. So that's been quite striking, and scientists have not really reached an answer to the question of why that is.
That's amazing to me to hear you say that, because I feel like within my friend group, like from, I don't know, ages, 20 through maybe like 45, we've been talking about it more. I mean, it's just been coming up in conversation more.
That dialogue is super important, obviously, and as far as catching it early, talk about the importance of having those conversations like Alexis was talking about. Just bringing it up can make a difference.
Yeah, luckily younger people are better at talking about this than older generations were, my generation and beyond. People want to be very aware of their own stool habits. Any changes in their stooling patterns, bring to the attention of your doctor. The most common symptom of colorectal cancer would be rectal bleeding. Rectal bleeding is common from benign causes like hemorrhoids, of course, but any persistent rectal bleeding you ought to bring to the attention of your doctor. And of course, screening, we're still not screening everybody at risk for colorectal cancer in the United States.
Andrea, my friend, I feel like whenever we talk about this, you come to mind for me, because you've been advocating for, about this and trying to empower people for quite a while, especially when it comes to early detection and screening. How did you address your stage 3 diagnosis, as it occurred for you at a pretty young age?
Yeah, I was 35 when I was diagnosed.
Wow.
And when I found out, I told my mom, I am going to turn this into something positive. And that's how I handled it, other than saying, what's the surgeon doing?
I love that. But the fact that you went at it like that, because it could be something scary. I mean, I know you talk to people all the time, and every time I see Andrea, I'm like, there she goes. She's on her brigade. She's in it.
Well, it's so important to have someone like you, Andrea, who can kind of help people navigate that too, because it is scary, especially when it's younger that's happening.
Yeah, oh, absolutely. There are lots of organizations. Every hospital has, every cancer center has social workers, and I know that finding my people, was a huge part of, my advocacy, but also my healing from it. And so, walking into somebody's room or taking a phone call and saying, deep breath, I'm here, we've got you, you'll be all right.
I love that.
Just walking them through that, easing their fears.
I always ask people, especially now that you have some time and some perspective, and you're around this literally all the time, if you could talk to yourself when you first were going through your journey and you were sitting, in his room, if you will, what should you have asked him back then that maybe you didn't ask?
Oh, goodness. Wow. I would have asked why it's increasing in young people. That's the one thing I would have asked.
What would your answer have been?
Well, there's some theories about why it's increasing in young people, including having to do with the North American diet, having to do with broad use of things like antibiotics in youth, and increasing rates of overweight, but nobody really knows why this is. It's clearly a generational phenomenon, though, for millennials, older millennials, and down into Generation Z as well. So young people should be aware of this phenomenon.
And hopefully, even by just having this quick conversation, it just allows people to be a little bit more empowered to continue the conversation. Because when you were talking, things are just going through my mind like, I need to check on so-and-so. All right. So thank you all so much for being here.